can't hear you at all. Can you hear me? No. Let me leave and then I'll come back. Okay, can you hear me now? I can't hear you at all. Can you hear me? I'm not able to hear you at all. I don't know what's the problem. Oh, God.
Right. We seem to be experiencing some challenges with connecting with Sibongile. Um, Today is the first day of August 2020. This month is designated the Women's Month. Now, on this channel, we decided that we are going to invite a number of guests, women guests, people who are movers and shakers in their respective, industries or professions. So the first person that we have invited today is Sibongile Mangayi Rath. She is the co-founder of a group of clinics that is called Alma Clinics. She has just launched the first of those clinics in Soweto, which, by the way, is her hometown. But she has got an interesting background because she studied to become an architect. So she got her national diploma in architecture from CPUT. She went further and studied BTech in architecture from the same CPUT in 2003. And after that, she established her own, consulting firm, that is called Indigo Kulani Group, which started as a small architecture practice, but grew over the number of years to become a big player in the healthcare infrastructure development in South Africa, in Tanzania, in Nigeria, in Angola, and in Swaziland. So with the passion that she developed in the space of social infrastructure development and with her personal development, she decided that it was time for her to study further. And so she went and studied an MBA, an executive MBA, with an institution called IMD in Switzerland. And she qualified with that in 2018. She continued to grow her, business. And then later, again, working with, organizations like DBSA, GIFA, and National Treasury, her business continued to grow. And with the experience that she has in infrastructure development, in investments, and also in digital health, she decided to combine her insights and her skills to try and come up with something that is innovative in the healthcare space in South Africa. She had identified the fact that South Africa has decided that the future of healthcare has to be primary healthcare. And that decision by South Africa that the future of healthcare has to be rooted in primary healthcare is also informing the whole NHL National Health Insurance Plan in South Africa. And so her identifying this as a growth area, as an area that she could disrupt, is actually aligned to the fact that NHI, which will be rooted in primary healthcare, is actually the future growth area in South Africa. Now, most people who are nurses, they will normally run a small one-person practice, but Sibongile Mangayi has decided that she's going to come up with an innovative type of primary healthcare clinic that will actually compete with what the GPs are offering, in their localities. She will have a nurse-driven practice that actually sees patients, but also have doctors supporting that clinic through technology connection. And so she's combining, use of technology to ensure that the skills that are required at primary healthcare level are there, but also ensuring that the practice itself is driven by nurses so that there could be affordability in the services that are offered by the Alma clinics. So what I'm going to do whilst we're trying to connect with her, I'm going to play a video of her clinics. It will be about 4 minutes long. And then at the end of that video, I hope that I will have been able to get her to connect. So let me play that video.
My name is Marcello Di Mano. I'm Italian and I live in Switzerland for 12 years. I'm the Chief Digital Office of Alma Clinic and co-founder. My name is Dr. Suana Nomadi. I'm a Brief Director and Chief Medical Officer of Alma Clinic. I'm Sibongile Mangayi. I am the co-founder and the Chief Executive Officer of Alma Clinic.
Hi, Sibongile. I hope you haven't given up.
One is the well-researched crime sector, which is very expensive and only caters to 70% of the population. And on the other hand, you've got the public sector, which caters to the majority of the.
Yes, can you try it again, please? Because I'm now playing your video at this moment. So we still have just over 3 minutes, Yeah, can you just try in again? Yeah. Yeah, sure.
Bringing quality and affordable healthcare and making sure that we go back to the basics. So what does Alma do? Alma is basically innovative itself through digital transformation, which utilizes limited resources to enhance healthcare services, particularly at primary care. So the Alma clinic is really to provide the patient with the quality, with the good, at the lowest level of care.
Okay, seems like it's working now.
Lovely.
Yeah.
I'm just playing the video.
Okay.
Alma Clinic is a primary care medical technology center, and nurses who clinic with remote support applications. It leverages a digital clinical platform to support nurses. It uses a two-sided platform that shares health data with patients at all times, called AppealPay. We'll make sure that nurses and primary care professionals are safe, and we'll make sure that the artificial intelligence to support of the doctor or specialist who will be able to assist where it is possible. The app is able to automate the decision process related to what is the diagnosis that is most probably associated to the patient, then it will identify the treatment plan that is associated to the diagnosis. So all this is done by the cell leveraging innovative technology like artificial intelligence. It offers enhanced PhD screening through point-of-care diagnosis, leveraging your AI and machine learning for clinical decision support. And ALMA, basically, its objective is to be able to promote preventative care over curative care to enhance PhD medical technology services. Much of the time.
All right. That was a video, a corporate video of the Alma clinics. Our guest is now in, Sibongile Mangayi Raf. Sibongile, welcome to the Dr. Fundi channel. Apologies for the technical challenges.
Thank you very much, Dr. Fundi, and good afternoon to everyone.
Yes. All right. Let me just try and stop that video. Okay, just give me a second.
Okay.
Okay. I hope there's something that was playing at the background that was disturbing me. All right. Sibongile Mangayi Raf, welcome.
Thank you.
All right. Just tell us who Sibongile is, please.
Okay, Sibongile is from born in Soweto in Dube, from a family of 14 children, elderly parents. I'm the last child of the 14 children. I had the opportunity to have many brothers and sisters. So even though I'm the last child, I'm not the usual spoiled child. So
well, it's for us to judge that.
So yeah, Sibongile grew up in Soweto, Edube, and I then went to
Sibongile, just give me a second. There is something that is still disturbing me here. Sorry.
Okay. Yeah.
Okay, there's something that is still disturbing me here.
Maybe I should start dancing to the song.
Yeah, because I don't know what is this song coming from. It's interfering with our interview. And it's not a soundtrack of Alma clinics. So I don't know why I'm experiencing it here. I just don't understand what is happening here. right. We seem to have found where the problem is. Right.
Okay.
All right. I think the song is now gone
Yeah.
forever. All right.
Okay.
There was a YouTube thing that was playing behind. So at the end
Okay.
of your YouTube video, it went on to play something else.
Yes, yes,
So
yes.
the first time I'm playing a video during an interview. So that's why I'm getting these little technical glitches, but I'll get okay. Right.
Yeah.
So you were still telling us that Sibongile hails from Soweto.
Yes.
And you
And
come from a large family of 14 people, 14 children.
yes, yes, yes. And I went to school in Soweto as well, in Meadowlands, primary school in Meadowlands. High school, I went to Bedford View High School, and I went to study architecture in Cape Town. And after graduating, I
You're
obviously
moving very fast. You're moving
yes,
very,
yes.
very
Okay.
fast.
Sorry.
You're moving too fast. I still want
Okay.
the Soweto part. You grew up in
Yes.
this family.
Yeah.
Now,
Yes.
remember,
Yes.
I'm profiling you as an entrepreneur
Yes.
to know where this entrepreneurship started from.
Yeah.
So that's why I'm saying you're moving fast, because I know there's a part that you are not telling us about what you learned at home, supporting,
Yes.
supporting your dad.
Yes.
Let's start
Yes.
there.
That's true. That's true. Okay. I come from a very entrepreneurial family. My grandfather was a coal merchant. So he basically left Limpopo to come and find work in Johannesburg. This was in the early 1900s. I think it was about 1915. And when he got here, he decided that he actually wanted to be an entrepreneur. So he eventually started selling coal in Sophia Town before they relocated to obviously to modern day Soweto today.
Yeah.
And my father as well. Then when he eventually moved from Limpopo to Johannesburg, he worked in a furniture shop for almost the amount of time I worked in corporate, which was 6 months. And then he decided that he wanted to be an entrepreneur as well. So obviously we were 14 at home, but we didn't all live at the same time in our home because my dad and my mom, when they had me, they were quite elderly. But always, my siblings and I always worked in our father's business. And I think it was a very good strategy for my father to be able to lower his costs, for the business, for running the business, because it was cheap labor. It was free labor.
Yes.
So, but by the time I was born, my dad was obviously, I think my dad was a general trader, if I were to call that, right?
Yeah.
He was not trading the stock exchange, but he was trading what was available in his
Yeah, it was a general deal of some kind.
Exactly.
Yeah.
So he had, so what we did is that when I was born, of course I was born in this family where my mom as well worked for my dad. So it meant that when I was little, my mom had to carry me to go and do the things that my dad needed to be done in the house, to trade. And then this, I think, exposed me very early in terms of being able to, our day started at about 4 a.m, and all of us will get into the back of my father's car and go to Aikenhof now, to basically pick up maize meal. Their supplies. And it was maize meal at the time. So we had to go to the field. So it was not just going to buy the maize meal, that is prepared. So we had to go into the fields, pick up the maize at that time in the 80s, 90s, there was still a lot of farming around Aikenhof.
Yes.
And we would come back. And when we came back, we would basically be back in Soweto at about 6:30. We'd be back. When people are waking up, we were coming back from picking up maize meal, and would have to prepare and obviously go to school. And when we went to school, my dad went to sell the supplies, of course, and then my mom would stay behind and prepare food for lunch. So when my dad came back, he timed it in such a way that when we came back from school, he would also be coming back at that time. And then we would have lunch as a family, which, I mean, I look at it now, I'm like, oh, I was very blessed to come from such a family where, I mean, we had two key points, which lunch we ate together, we worked together. And so when we came back from school, we would then have our lunch as a family. And thereafter at about 2:30, and then we would then have to go and do another shift. And this shift was basically to basically sell. There were other parts, other members of the family that would need to go and sell the fresh produce in the different train stations. And then there would be, my dad would then go with one of my siblings as well to then go and collect bottles. You know, I don't know if you remember, I mean, those that are from Soweto, they would know what we call banana car, right? So basically, banana car is that you have this crisp, you know, and then you give them to the kids, and the kids bring the bottle. So it's an exchange, like a bartering kind of a transaction, and those will be sold the following day. So and that's how my dad was. So. And he timed his businesses were always seasonal, because as you know, that maize is very seasonal. So when maize was not there, he would then look for other fresh produce to basically be able to sell in that season when they were in.
So growing up in that type of family, how did that influence you to actually, you know, get into entrepreneurship? What can you look back at and say, that and that and that, I definitely got it from what my dad used to do, you know?
Absolutely. I think one thing that I can look back right now and I say I definitely got it from my dad is to do whatever is necessary to get the job done. So I don't come from my family. My dad was, it's not about that you are tired or you know what, it's difficult, or I can't get a job. You just have to do what you need to do to get it done. I think that was important. The second one was how to be able to be strategic in terms of being able to understand the opportunity that every season basically represent a different opportunity. And my dad used that in terms of fresh produce, in terms of what the kids needed, in terms of what the kids' parents needed. So he basically designed a whole ecosystem that made sure that he had a product for every segment in terms of his clients.
Understanding of the needs of the clients. You mentioned, you know, in your profile that you learned persistence, dedication, and determination. Can you just expand on that?
Okay, you know what, my sister actually reminded me about this last year when I was going through a very difficult pivot, right, in my business. And she said to me, you know, Sibongile, Mom always said that even if the door is locked, you will find a way to actually create a way to open it, even if you squeeze through it, but you will not give up, right? And I think that is something that my mom probably observed it, but I think I learned it from my dad, right? In terms of when you want to do something, you know, I mean, people talk about resilience, for example, and I'm really trying to respond in a way that could link the two together, because persistence, a lot of us talk about persistence and determination, but all of these things, they build resilience. But then without resilience, which is something that a lot of people have actually identified, to say, Sibongile, you're so resilient in what you do. It's that every challenge that you face as a person, you know, it presents an opportunity. So, for example, like I said earlier, that my dad always, there were so many challenges. So during the apartheid times, right? A lot of people would have wanted to have a safe job. But for him, he looked at these challenges that, I mean, a lot of Black people didn't have opportunities to get good jobs. But he said, you know what, I will create my own opportunities, because that will give him freedom to be able to raise his children, which he did, and educated all of us. So I think that for me has helped me to be able to say, in times of challenges where people see difficulties, I see opportunities. And I think to be able to actually respond and see the opportunities, you will need to be persistent, because it means it's not really a straightforward solution that you might have. And I think that came from my dad. Yeah.
Yeah, lovely. And so you went and studied architecture at CUT, you know, started with a diploma, BTech, and then, you know, and then you then went to work for a corporate, but you only lasted for like a few months. What happened?
You know, actually, before I even talk about the few months, it's actually how I got to Cape Town. So at this time, my dad was very ill and was not working anymore. And I remember begging my mom to give me, to buy me a single ticket to Cape Town. I'd never been to Cape Town. And here I am asking this elderly woman to buy me a ticket. And I said, all I want is a ticket to Cape Town. And she did, right? And I went to Cape Town on a single ticket. When I got there, because I was a couple of days late because I didn't have the money to buy the ticket. And then they told me that, no, civil engineering, it's actually quite full. I wanted to study civil engineering. And then they said, you know what, there's a course, it's a very difficult one called architecture. There's a lot of dropouts, but it's the only one that probably you can give it a try. So I was like, okay, right now, I only have a one-way ticket, right?
There's no way
I have
to go back to Joburg.
I'm not going back to Joburg. So then I said, okay, let me give this course a try. And then that's how I actually ended up in architecture. And because I knew, I was told that there's a high level of dropouts, I really made sure that I worked so hard to make sure that I'm not one of those dropouts. And by the second year, I was one of the best students in my class without any technical drawing training in high school. And I was with people that studied art in high school and all of those. They were quite sure they knew in high school what they wanted, that they wanted to study architecture. For me, it was like...
it was just something that you got into by chance. That's what you go back to Joburg.
And I didn't have a bus ticket to go back to Joburg to start with, right? So that was my start in architecture. Then I eventually completed my studies and I came back to Joburg. I mean, the reason as well I came back to Joburg is that I had to understand the environment as well. I saw the environment of when I assessed the environment in Cape Town, I found that it was going to be difficult for me as a young entrepreneur. It's not a very entrepreneurial sort of environment. I know now they're saying that they've got Startup Cape Town and everything else, Silicon Cape Town, something like that. But for me, Joburg was basically the engine of entrepreneurship, you know. And I said, I'm from this obviously environment and I understand how it functions. And I believe I can actually break the ceilings. So that's how I came back. And then I got this job.
Let me stop you there.
Yes.
As you were doing your diploma and your bachelor, qualifications, did you grow to love the discipline of architecture, though? Remember,
absolutely,
you by chance, but the discipline itself, which is still part of the built environment,
yes. Yeah. Actually, I really did, because I remember how I chose engineering was I picked it because my advisor in high school, when I described what I wanted to study, I was commuting from Soweto to Bedfordview each morning. And when I was on the bus, I realized that they were actually building, it was a time when the Absa Towers were under construction in downtown Joburg. And I would see sort of people in the morning almost congregating almost at the same time. But what I realized was that there was no women and then there was no Black people, right, in that congregation. And I think with time you notice patterns. And then I actually asked myself, what were they doing? Why is that I didn't see any women of any race, and I certainly didn't see any Black people or Indian or things like that. I only saw white people. And for me, that was something that I felt it drew interest in me. And then I asked my advisor in high school, and then he then said, because of the description I gave him, he then said, probably it could be engineers and architects. And I think I just caught engineers, right? Yeah. So that's how I chose.
That's how I. Yeah. And so, okay. So
So I
then
loved it. I loved it. Yeah.
you grew and loved the discipline. You even
Yeah.
did, a bachelor thing on top of the
Yes.
diploma.
Yeah.
And then you came back to Joburg to look for work.
Yes. I came back to Joburg to look for work, and I found work. And when I was in corporate, I realized that, being in corporate, um, there were still challenges in terms of diversity, the opportunities that were given
Yeah.
to particularly Black people. And once again, I said, you know what, I'm not going to go and beg for opportunities for somebody to give me a better project. I'm going to create my own projects, like the ones that I want to work on. And that's how I decided to leave corporate, because I felt that my destiny was in the hands of another person. And I didn't grow up like that.
Yeah. All right. So, I mean, that was like, what, less than a year?
6 months, yes. Yeah, it was
6 months.
about 6 months, yes. And I was fortunate enough to also early on partner with a friend of mine, a friend of mine that had a project, a very big project. It was the extension of the Grace Bible Church in Soweto. So I worked a little bit on that project, and with him, while I was looking for other opportunities, which I did get. And that's how I basically started Indigo Kulani Group.
And you started that when you were age 26, all right? You were still very young.
Yes, it was around this time, yeah.
The bug that was, that you actually got when you were still growing up, just was like, we can't allow her to work for others. She must work for herself. She must create employment. All right. And so you went and started this Indigo Kulani Group. Tell us a little bit about that.
Yeah, so when I left my job, first of all, I have to say this. So my mom was in panic, in great panic. Yeah. And she then called my sister, and she said, who's going to buy food for us? How can she leave her job, So it's quite interesting that she was more worried about who's going to look after her if I leave my job. So
yet you actually grew up in an entrepreneurial environment, which, I mean, there's no guarantees when you're an entrepreneur. She married an entrepreneur,
Yeah, yes, but she was the administrator, but not the entrepreneur. So administrators, they don't like to take risks like this.
Yeah. Okay.
So then I started Indigo Kulani Group in 2006. I was 26, and initially, obviously, I started by myself. It was a small architectural company, and then I brought in quite a few friends that I knew in the industry that were good. We had shared values in terms of work ethics. We had studied together. And but early on, I realized that actually, when we started tendering for work from government, that the government was procuring in consortiums. And one of the challenges with consortiums is that you start looking for people to partner with when the tender is out. Yeah. So because you're so desperate, you can go into this partnership with people that you don't know. And twice we went into challenges with performance post award of the tender. And I think that bothered me, because I knew that I was looking long term, and I didn't want a situation where my reputation was put at risk because of underperformance from the consortium partners. And then that's how I actually started looking at how can I build a company that can be multidisciplinary, because in that way, when I go and stand in front of the client and say, we are Indigo Kulani Group, we can do this and that, I can actually I'm promising something that I can actually deliver, because it's all basically coming from the same company, instead of partnering with other people, which I still believe in partnering people, and we did grow through partnerships with other companies. But many of the work that we did internally helped us to be able to build a very strong brand very early on. Yeah.
Yes. And you expanded beyond South Africa, Tanzania, Nigeria, Angola, Swaziland. Why healthcare infrastructure though? Did you guys consciously decide that you are going to specialize in the healthcare space?
Yes. So we chose three sectors. It was we wanted to actually, what we decided with my partners was that, it's great that we can offer our services in terms of just being transactional, but we don't want to have a company that just focuses on transactions. We need to look at impact as well. And then we said, which are the sectors that we can create the biggest impact? And then we said housing, access to housing is still a challenge in South Africa. And when we say access to housing is how can we make sure that people are living closer to places of opportunities? I mean, I read the book of Steve Biko, I Write What I Like, 20 years ago, and I understood exactly the the impact of people living too far away from places of opportunities, the impact that it has on the social aspect of their families as well. So we chose housing, we chose education, in terms of, and education is such an integral part of being able to make sure that you can prepare the human capital in terms of the future. And then we also looked at, we then chose healthcare, and particularly healthcare because it's such a basic need. If you're not feeling well, you cannot go to school, you cannot work, So we chose those three sectors as sectors that we wanted to focus on as a business.
Yes. And then at what point did you guys then get to deal with the DBSAs of this world, Development Bank of South Africa, the CFAs and the National Treasury, within various structural projects?
So what we realized was that the way infrastructure was basically being implemented in our country, and I mean, to a great extent, it's still implemented like that, where it's very reactional, right? Where, for example, you find that schools can be built in an area where there's already an existing school that is being closed, and then you find that so resources get to be concentrated in one area over other areas where there are needs. And then where we started getting involved with the DBSA, particularly DBSA and Treasury, was how can we actually start looking at infrastructure planning. And then infrastructure planning has to be long-term, has to meet the needs in a immediate, but also long-term as well. And in that way, it's a lot easier for the various departments to be able to plan their capital and also to see if they've got the budget to actually meet the infrastructure needs, or will they need to be able to go out and actually raise capital, or can they look at different models of actually implementing infrastructure in terms of PPPs as well, so for us, we're always trying as a company to really look at how can we look beyond the transaction of just getting paid for services, even at that level as well.
Yeah. And so issues of investments and digital health, when did they come into play now?
Yes. Okay. So first of all, I mean, having worked in the infrastructure space for such a long time, more than 10 years, it really, you get exposed to the challenges that exist within the sectors. And I mean, as an entrepreneur as well, you have to choose the challenges that are a lot, how can I say, can be more impactful, but also in terms of how can you make the greatest but quicker impact, right? Yeah. So I went to study my EMBA in Switzerland 2017, yes. And as you know, that Switzerland basically is almost the mecca of healthcare and innovation. And I think having studied my EMBA there, it exposed me what they have at IMD Business School is that during your EMBA, you get to travel to different countries. So we had to, through an expedition, and you're exposed to those countries and the companies that are basically driving innovation in those respective countries. So we went to India, we went to China, we spent time in Silicon Valley, and to travel to these countries as well and working with these entrepreneurs in these countries, it also almost got me thinking to say, what can I go back home and do? Because now I can see that with technology, there's so much impact that you can actually create in communities in different sectors, and that's how the interest came in. And then I met one of my classmates that also is a healthcare specialist, but more in the IT. And then we started talking about how can we come together as a team to be able to create almost a solution that can basically leapfrog, particularly in terms of sub-Saharan Africa.
Yes.
Because if you look at healthcare, right, you have the higher income countries, which have obviously greater resources. So they've got huge infrastructure, you know. Yes, the cost of healthcare is actually exploding there as well. But for us, we are quite behind because we don't have the resources to build this expensive infrastructure. And actually coming from infrastructure, I know, I mean, CAPEX is your biggest cost, right, in any development. So we said, okay, but technology can help us to leapfrog. We don't have to build this huge.
Actually, that weakness of being behind is actually an opportunity, you know, because then you are not linked or attached to certain investments that you've already made. You can leapfrog using technology and actually, you know, jump so many stages. Sometimes they are even ahead of those developing countries, you know, if you use the technology right. Yes.
Absolutely. I mean, you're so spot on. You said sometimes you can be ahead. If you look at the services that we are offering inside ALMA, people in Europe don't have those services as we speak today. At the primary
get to ALMA, because that's the real reason here. I wanted to build a story so that people know this Sibongile, the journey she has traveled, so that we can get to ALMA. Now we're gonna get to ALMA. So you're still saying then, so you guys went to all of these countries and you started seeing good things in those countries, and you saw opportunities that you could bring those leapfrog and establish, you know, stuff that has never been seen.
Absolutely. And I think it's also, hence that's why I always share with a lot of young people that you know, before when you start working, don't buy a car and buy all these expensive things. Travel. Because when you travel, you learn, you continue to learn, you are able to see and travel with an inquiring mind, because it's one thing to travel and then go shopping. And then it's one thing to travel, but with an inquiring mind where you are seeing opportunities that you can come back home and actually be a solution. Because if you look at the challenges that are faced by particularly the African countries, I mean, if we all immigrate, I mean, where are we going to immigrate to, right? So at some point, there are those that will need to stay and say, how can I be a solution? But if you don't see a solution, it's very frustrating, because you think that I'd rather go to other countries where things are working. But I mean, if you look at someone like me, I'm saying, yes, there are great challenges, but these great challenges means there are huge opportunities for us to be able to create solutions that can, first of all, from a business point of view, they make a lot of sense, but also from an impact point of view. And you know, and those are some of the opportunities that travel and being able to learn from other countries can actually help. And it's not traveling to only to higher income countries. You don't have to go to Paris to learn. You have to go to these developing countries, because that's where innovation is, right? Because there isn't an illusion that things are working. People know things are not working, so they're continuously innovating. I mean, India is just amazing, you know, as a country.
Yes, lovely. And so your eye was getting, you know, to zoom into healthcare now. I know there were things that you were looking at as IKG, but now your eye is zooming into healthcare. What happened to IKG? Is it still there?
Yes, so IKG, so when I decided to take my EMBA, one of my partners, he comes from the investment industry. He took over as the CEO of IKG Group. And I mean, at the moment, IKG is still doing great work in the infrastructure, in the infrastructure space. And I mean, at the moment, we're busy with quite a few large hospitals as well in the province. So we are still very happy
you are still a shareholder of IKG, non-executive director, maybe?
I'm the executive chairperson of the company. Yes. Okay. But I'm not involved in the day-to-day. Yes. Okay. My focus is now on the
on this new baby. All right. Yes. So how did you identify the gap that made you decide I'm gonna create the ALMA, you know, the ALMA, you know, group of clinics?
Okay, I think the gap came from my own personal experience. Most of the initiatives that I take, they come from personal experience, and hence that's why they are not a job. They become something that I do for fun, right? My job, the things I do, for me, they're fun because I see them as trying to make sure that another Sibongile, how can another Sibongile today, the young Sibongile today, have a better experience? So I'm from Dube, but the nearest clinic to where I grew up was probably around 8 to 10 kilometers away from us, and we had to walk to that clinic, right? And things have not changed today. And secondly, however, maybe what has become worse today is the fact that there isn't, even though, I mean, we have this huge infrastructure that government is spending a lot, which is great. But then if you look at the services part, that has not improved, has actually declined over the years, in my view.
Yeah.
So, and then we then said to then, and I think for me, and then secondly, was that both my parents, I mean, my dad is late, but both of them were diabetic, they were hypertensive, cholesterol treatment. So, and then I started reading a little bit more and understanding the real pandemic, you know, that it's actually a non-communicable disease.
Yes, non-communicable
And then, absolutely, I mean, if you look at, they say South Africa is the most dangerous country, is one of the dangerous countries in the world, right? But if you look at what is the cause of death in our country, more than 55% is
It's
actually non-communicable.
58%. Yeah,
Yes,
58%.
it's non-communicable disease,
disease.
which for me was a big shock because I thought it was actually probably could be homicide, right? But
And from 2010 to 2016, it increased by 10%, you know?
Yeah.
So it's a rapidly growing cause of mortality in this country, that group of
absolutely. And then if you look at it, you know, there is those that get better those that get better treatment are those that have medical insurance. So they would go to your you know, the private institutions like CDE, for example. But then if you look at the fact that there's only about 13% of our population that have access to medical insurance, what happens to the majority, right?
Yeah.
So, and then I said, and then I realized that as well, a lot of our facilities at primary healthcare, they have a shortage of physicians, right? And the people that we have in our country, you know, that we have a higher ratio of them is actually nurses.
Yes.
So then that's where I then started saying, okay, how can we come up with a solution where we can be able to empower nurses so that they can be able to actually offer services at community level, but with probably a much more sort of intelligent solution, right? And when I say intelligent solution, is that there are things right now that can only be done by a specialist, but the needs are growing and we don't have enough specialists. So how can we create a technology that can actually do what the specialist can do? And we take this technology and we give it to a nurse. So in that way, it means that we can provide greater access to the community, but using obviously not expensive resources like a specialist. And first of all, we don't even have enough of these specialists. So that's where the idea came about.
To attract them to work for Alma.
Absolutely. Yeah.
So what did you guys do then?
So what we did then,
have these clinics that are nurse driven, but you still need to have access to doctors. So what solution did you put there?
So what we did is that, okay, so what we did first, we then said, okay, before we get to the clinics, let's build a digital clinic. What could this digital clinic look like, right? So we had to understand the patient experience to say, how is healthcare being delivered at the moment, right? If you look at in many primary healthcare facilities, you find that patients are being still treated in terms of they treat the symptoms, and a lot of the system itself, there's fragmentation before you even talk about the human part. So if you look at the fact that you've got your primary healthcare that basically just it treats on the basis of symptoms, and then it's only when your symptoms don't improve that probably they'll say, okay, let's take your biomarkers, then you go to a laboratory, and then the results come back. But that lag period is quite prolonged as well, right? And then we said, is there any innovation where we can try and bring these services that usually take quite some time or are not even accessible and bring them at primary healthcare level? So we then basically created this digital clinic that basically integrates or closes the diagnostic gap between primary and secondary care. And then we called it the AbioCare platform. And then once we've designed this AbioCare platform.
So this AbioCare, was it an off-the-shelf thing or something that you guys built from scratch?
Yes, so we basically built it from scratch. We looked for developers in Eastern Europe, and we found that it was very difficult sometimes because we wanted developers that were experienced in building digital health solutions, because you can speak to any developer that they're great, but if they're in fintech, they cannot necessarily understand healthcare. So we eventually found developers in India that understood healthcare. I mean, India is actually driving great innovation in the healthcare space. So we've been then we spent almost 18 months working with this team remotely. My partner was in Switzerland. I'm based here. And then we had a team. We worked with also a Swiss doctor, and we had a South African doctor as well. And then what we did is that we also didn't just build it. What we did is that we said, I mean, like I said, that we wanted to create an intelligent solution, right? So we then said, okay, we need to make sure that this solution is using best practice standards. So, and what we did is that we looked at the journey of what is the process of the journey of a person that is diabetic or obviously end up with comorbidities or with disabilities. We then looked at the South African standards, we looked at the European standards, we looked at the American standards. We eventually found, because we wanted to build a preventative solution as well, because not just about curing and treating or helping the patients to manage it, is that how can you catch the patients when they're at risk? And at the moment, there's only one sort of medical health standards that we felt it was the best, is the Canadian one. The Canadian one looks at preventative, the preventative care. So we then, and then what we did, we then obviously incorporated that in terms of being able to basically start building the algorithms to be able to actually make sure that, okay, this patient, looking at particular, let's say, biomarkers and your vitals, we think that you are at risk. And sometimes it could be, for example, it could be of course, your age. You might be, your biomarkers can say, you know what, you are not at risk at all. But when we look at profiling, because what we do inside AbioCare, we profile your lifestyle as well when you come and visit. So through the profiling of the lifestyle and your demographics, which is something that you can't change, we're able to tell the patient to say, you know what, everything looks good, but if you continue with this, you know, maybe the kind of food that you're eating, not exercising, in 4 years, you might find that your BMI might increase, and this might be increased. You might start facing some issues with regarding to being pre-diabetic and all of that.
Using technology, you know, when I was listening to your video, there was issues there around using AI and all of that. So using that type of, you know, technology, you are almost able to predict the likelihood of certain things happening.
Absolutely, and actually give a patient a care plan on how they can be able to prevent that, right? But I think one of the experiences that we've had is that, you know, it's one thing to say to the person, you know, you are at risk, but we believe that education is a very big part to this whole solution, because patient education. If you think about it at the moment, you find that many of us, when we go to doctors, we are sick, and then or we go to a primary healthcare facility, then, I mean, obviously I'll be assessed, and then on the basis of assessment, I'll be given a certain treatment plan, right? But then most of us, we also don't ask as the patients. You're ready to probe the doctors because somehow there's an assumption the doctor knows everything. But the doctor as well does not explain in detail because the relationship has always been like that. There's a trust, which is great, You're supposed to trust your doctor. You don't want to go to a doctor you don't trust. But that trust has left a vacuum in terms of being able to educate the patient around taking ownership of their health decisions, particularly when it comes to non-communicable disease. So it was okay when we're dealing with infectious disease because I get some treatment plan and I'm cured, then it doesn't matter. I can carry on with my lifestyle. But this, it has an impact on my everyday choices. So the relationship, so we are seeing what we are doing, not just a digital transformation, we're seeing it as a cultural transformation, where we are saying culture and social customs between a relationship between healthcare providers and patients has to be transformed through transparency, through open communication, through and when we say transparency, it's about when you look at Abioke, it's a two-sided platform. It's a practitioner side where the practitioner will have all the vitals and obviously the medical records of the patient. But what happens is that when the patient leaves our facility, they have the same as well. So but it is before they leave, it is the responsibility of the healthcare provider to then explain through obviously the graphics to say, what does it mean to be at risk? What is diabetes at all? If you are diabetes, for example, you have to manage your glucose levels, right? What is your target? Because if you don't know, you will take metformin and all these other medication, but then there will be no improvement. If eventually, I mean, this happened to my mom. My mom eventually went into insulin because she didn't know. She even had a glucometer. She was checking every day, but she was not know what she's checking, you know? But so it's all of it. But if the head doctor had told her that, you know what, if your glucose level gets to a certain threshold, this is the number. Even though she's elderly, but she understands because it's a health and she wants to see her grandkids grow, right? All of our mothers want to see that. But it's that level of, communication that needs to be almost put into the picture. And that's what we are trying to do with all that we're doing. I mean,
So like you said earlier, I'm sorry to interject.
Yeah.
Like you said earlier, you guys are trying to change the paradigm of healthcare delivery in South Africa. A system that has always been reactive, system that has always been biased towards curative medicine. So you guys are actually driving the preventative side of healthcare, which is health promotion, which is prevention, which is early detection. That's what you guys are driving. But
absolutely,
that side has always been ignored because it's not very sexy. That is the preventative side. It's not very sexy. There's not a lot of money that people were making, but there's more opportunities of making money on the curative, because then you can order expensive scans and expensive bloods and expensive this. So you are coming into this area that has that everybody talks about. We need primary healthcare, but in reality, when you look at primary healthcare, it's the government-owned clinics. Even those are not really doing a great job. Which is why people would flock at secondary level. So you guys decided you are coming in and you are going to go into that primary healthcare. And in fact, you are going to compete with the GPs, in terms of what is being done there. How has the reception been by the community?
The community, first of all, the community has been, at first, they were a little bit shocked because they've never experienced something like this. In terms of the design of the facility itself to start with, because there's always an assumption that because it's affordable care, it shouldn't be as state of the art, and coming from the infrastructure helped me a lot in terms of how to make sure that we don't only design the Abioke digital platform, which is very patient-centric, but how do we make sure that the physical clinic is of the highest standards in terms of making sure that when the patients come in and they're sick, they come into a facility that is bright, that has sophistication to it, and making sure that we get all of our staff is from the community. They walk to our clinics, and then we actually train them to say, you know what, you need to understand that when people come here, it means they're not feeling well. No one who's feeling well is coming to the clinic. So we need to make sure that also, because it's new and it looks very sophisticated, sometimes patient might feel not, those probably when you visit friends and they're very fancy houses, you don't know where to sit. We said, you know what, we don't want to create that culture here. So we've designed this fancy facility. We need to make sure that our warmth as a people, as a staff members, is welcoming. So that's the first thing that we did, right? And then also what we saw was that they were also appreciative in terms of, because the whole digitization has created efficiencies in terms of screening and diagnostics as well. So what happens is that then the nurse is spending more time with the patient around education and explaining what the biomarkers indicate, what do they mean, and all of it. And I think the community appreciates it a lot. So even now, we've not really been spending a lot of, we've not spent a lot in terms of advertising, but a lot of our patients is actually referrals, because, and when we ask them, they say, no, my neighbor said I must come here. Or my mom said I must come here. So we're finding a lot of that, because we wanted to test that as well, because it's so much easier to then go and spend a lot of money on advertisement and then have people coming because you've advertised. But we wanted to test that. Can people come back? Yeah, can they come on the basis of their experience? Can they refer us on the basis of their experience? And that's what we are testing in terms of the business model at the moment.
Yes, but there's a part that you have not yet explained to me, which I picked up in the video, that you also have got a virtual medic that supports the nurses.
Yes. So, I mean, a lot of people, when you say you have a nurse-led primary healthcare facility with obviously leveraging technology, they're like, okay, are you competing with the doctors? We're saying no. We don't even have enough doctors in our country to start with, right? That's why we've got this solution. So what we are doing is that the way we've designed the entire solution is that the doctor the nurse can always connect with the doctor. Dr. Nomadi is based in Polokwane as we speak. He's based there. But then through the digital platform, I mean, if you look at telemedicine, and I just want to address the issue of telemedicine and link it to this, right? If you look at telemedicine, it's being celebrated at the moment, right? But then there's some gaps to it, particularly a lot of the solutions that are out there, because it's somebody calling a doctor and presenting their symptoms virtually, and the doctor giving a prescription on the basis of the symptoms. If you look at what Alma is doing, is the nurse sending the patient's biomarker, actually not sending anything, is the doctor logging into the patient's profile and looking at the biomarker, but remotely, and being able to understand what is the status of the health of that patient. And immediately they can give advice on how to actually treat the patient remotely, but with the patient's specific biomarkers. So it means that treatment will be personalized to that patient instead of basically giving treatment on the basis of symptoms.
Yes, lovely. And how is that working?
That is working quite well. I mean, I've got a good example. Yesterday, my mom went to the clinic herself. So, and
was she there as a mystery patient, to test the service, or she went there as a VIP?
No, not at all. I didn't even go with her. I think, there's something that, and the reason I asked myself this, there's a lot of people that design solutions, but they wouldn't send their loved ones, or they wouldn't even eat the food that they are cooking in their restaurants.
Yeah.
So for me, this was a big thing to me to say, I believe so much in what we've done, that if I look at how my mom's chronic conditions have been managed in the past, I would rather she is in safer hands at Alma, right? And yesterday she came for the first time because we were trying to make sure, because obviously we launched in the middle of the pandemic. So I've been trying to, get her to be at home and isolation and all of that. But her glucose level obviously went up. So I didn't take her to her doctor where it has not been managed quite well. She went to Alma.
Yeah.
They took her biomarkers. They found out that obviously her glucose was quite high. And then immediately all of those, and the doctor was able to log into her profile and immediately was able to say, you know what, if I look at her history, the levels of medication that she's in the highest dosage of metformin, and this is what I'm actually suggesting, So she was able to get that, remotely, and not because it's her, it's the way it's working for all the other women. But what I like about this, for me, it is almost like a validation to say, I believe in what I've done, that I believe that my mom is much better in our solution than anywhere else. Yeah.
That's good.
It's like, I'll give a classical example, right? It's almost like I always wondered when I was growing up. So the teachers that taught us in the township, their kids went to the suburbs. I didn't want to do that.
Yeah.
So I cannot create a solution in our community, and then I still think that my mom is better off in Sentin.
Yeah.
Right?
So she must actually be your guinea pig, if I have to use that word. Obviously, there are standards you guys have put your best practices and everything. So it's not really guinea pig in that sense, but she must consume the service that you are offering to the rest of the people. And after you get feedback as well from her, well, she's likely to give you true feedback, and identify things that you may need to work on.
And, can I be honest with you? It's the first time, even I as a daughter and my sister, where we understand the true state of my mom's condition for the first time. We've been, we've been buying different medications for her. We've been buying different devices to monitor the glucose, but we were not even sure what it is that we are actually managing, because we didn't even have her medical health records. But right now, for the first time, we've created them. She's got a digital ID.
Yes. So this information that is in ABIO, so it's able to come out on the smartphone or somebody else's phone, that is the patient.
Yes. So what we do, we believe that sharing, the patient must own their own health data. That is very, very important, because that is the first point of empowering the patient to take ownership of their own health. It's their own biomarkers, it's their own health, right? So what we do when our patient comes to Alma Clinic, the first thing that they do is that we've got a digital health assist, which is a very young, techno-savvy young lady from the community. So what she does is that she's the one that explains to them and orientates them around what to expect in their journey within the clinic. And then part of what she does is to help them to basically download their BioCare, the patient app for a BioCare in their smartphone, and then tell them that when they leave, this is what they will be able to see when they leave the clinic. And then once that is done, then the patient goes through the entire journey. And when they leave the...
What about those people who don't have smartphones? They still have the old, we call them motilili, those old, phones before smartphones came in.
Yeah, you'll be surprised that people have smartphones. So yeah, I promise you. Hey? So I think it's a very small percentage where we've found people that would say they don't have smartphone. Boma Goko, they have smartphones, they have different, because right now there's different brands that have Android, which is quite great and it's affordable. So that helps a lot. Yeah.
Okay, lovely. All right.
And also what's nice is that the patients, they have the ability to be able to check their glucose level at home. Even if they don't have internet, they can be able to actually upload, input those levels. And then whenever they're in a place where they have access to internet, then it just basically updates their profile. And the clinic will be able to see that as well. Yeah.
When they come for the checkup, already you know, you guys have got a profile of how, you know, their sugar has been managed.
Yes, yes. But also if, for example, they're at home, they upload, basically they input their glucose levels and they're at emergency, because the system is able to actually see the emergency level as well. We're able to get notification at the clinic. So the clinic manager is able to actually get alert to say this patient has has basically inputted their glucose level, and it's an emergency, and then we're able to call the family member, that patient or their family member, to say, you know what, this is a situation, they're hyperglycemic, you have to do something about that patient. Yeah.
Beautiful, beautiful. So are there any customer feedback surveys that you guys have done already? I saw a few gogos, you know, on the video. They are very, very, very happy. But have you guys done any just, you know, feedback survey of some kind?
So at the moment, we've not done almost like a generic one. But what we've done is that we have spoken, obviously we've surveyed the people that we, you know, so those testimonials are not scripted. They are what they are. You know, Mama Gogo, you can't
myself, you know, if this person wasn't picked and, you know, they had to go through the script before, you know.
No, Mama, this Magogos, I mean, the one lady, she said, because our cameraman was running late for that interview. So when I got there, I kept apologizing. I'm so sorry, he's running late. They said, no, for Alma, I'm not going anywhere. I must say, I must tell the people what I experienced here. So that for me, it's very it's heartwarming as a person who comes from the community, to see this, you know. If you look at even our pricing as well.
I'm going to come to the pricing part. Let me ask you now. Obviously, like any business that's going to be launched, you sit down and look at what's your competitive advantage and how are you going to come in. Are you going to come in based on price? Are you going to come in based on, you know, service, you know, a superior service? Are you going to come in? So as Alma, as you were looking at, you know, coming into the market, what did you identify as your competitive advantage? You know, the thing that you're going to use, you know, to drive your growth.
It was transparency in terms of how are we going to, for the first time, almost give the people an opportunity to understand that we see them as partners. And that came from sharing of health information. We felt that it's something that is still lacking at the moment. And then secondly, it's something that, you know, it's driven by values. So one cannot just decide to compete. It's fine, they can compete with Alma probably to share. But then, you know, some things, they come, when we talk about corporate values, they're very difficult to copy, right? Because they're driven by something greater than just a business. So that is important. That was our competitive advantage. And we felt that, and when I talk about that, it increases patient engagement. When you engage with a patient, it means they trust you. They begin to say, I trust you. And we felt that would be it's a competitive advantage for us.
So
and
it's a service issue though. So basically the total experience, the service that you are delivering, the empowerment that you are giving to the patients that they are not used to, because in other areas of primary healthcare, numbers are being pushed. There's not enough time for them to be educated. So the service experience is one area, but you've also mentioned the issue of affordability. So it sounds like also you decided that you are going to deliver superior service at affordable price.
Yes, absolutely. I think price was, I think it was a very big issue for us, because we wanted to make sure that, first of all, we increase accessibility through our site locations. That was one. So hence, that's why retail outlets, it was important. The service experience was key in terms of how we're engaging with the patient. The third one was, obviously, it had to be affordable. And we were able to achieve the affordability through, if you look at the resources, you know, first of all, how do you streamline the entire process? How do you make sure that you have a very lean business model? And if you look at ALMA, I mean, all the things that we're talking about, especially when we talk about non-communicable disease, patient engagement, they seem like big challenges, right? But then we've taken these big challenges and actually streamlined them in a way that they are lean. And the minute you have a very lean infrastructure or business model, you are able to actually create obviously build greater value in terms of the patient. You're able to reduce your costs as well. I mean, if you look at our costs, we are looking at, I mean, there's people that are also looking at the setup like us, you know, in terms of they're in a retail outlet. A lot of the doctors, some of them is nurse run, some of them they're in containers, charging around the same prices we are charging as well. But we felt that the price had to be quite reasonable and affordable. So we looked at what people, our competitors at the moment are charging, right? So
can I ask you, because I want, what is the price of coming to ALMA?
The first visit, we've got two different prices. For Bomagogo, it's 180. And then for non-pensioners is basically 220.
Yeah. All right. And then if somebody has got a medical aid,
yes.
Do you guys accept medical aid? Are you recognized as ALMA, you know, by your discoveries, your bonitases, and all these other medical aids?
Yes, but we are recognized as a nurse-run facility, which is also quite great, because even we realize even our pricing is around what the medical aids actually expect a nurse-run facility to charge. Because also what we realized was that there's a lot of people you know, that, you know, it's obviously physician run, but there's a lot of nurses, but then the claims to the medical aid, sometimes they're under the physician. It's a difficult topic, but so we didn't want to do that.
Well, obviously you've done your, what do you call it, research in terms of the weaknesses of the competition and the kind of things that may actually rob patients of their benefits and stuff. But we won't get into that for now. But clearly you've done your homework,
And also what we wanted to do is that if you look at our people, if you look at medical insurance, it's very expensive to start with, right? So a lot of people, you find that they have to, if they go and pay about, let's say 550 or 600 rands, right, at a GP, halfway through the year, they run out of their medical benefits. So they're back into also paying upfront as well. But if you look at the pricing that we have, if we look at the pricing that we have, you look at the value add that the patient gets, if they come to ALMA, they don't ever have to run into those kind of challenges halfway through the year, because then, you know, we charge almost like 40% of what they would pay, right? But we still need, obviously, when we consult with a doctor remotely, there are certain, obviously, rates that are agreed with the medical aid, you know, but it's still, the patient doesn't have to run into those challenges where they say, okay, your benefit have been depleted, you know.
All right. So does the consultation fee or the fee that you guys charge include medication for the goggles? Because goggles are used to going into a place, they get seen, they get given an injection or they demand an injection, whether it's necessary or not. And then they also want to come out with meds for so
that was important in our business model. But you know what, so I'll give you a classical example. So there is a certain patient, elderly. So she knows she's diabetic, she's on her medication, and but obviously she's not adhering to the plan. So, and then we said, okay, but you know, she said, no, she's here to get medication, you know, so she's not feeling well, her glucose level was high. So, but she's here to get more medication so that she can feel well, right?
Yeah.
So it's those things where we're also, we know it's hard. We know it's hard what we're doing, but we believe it's worth a try. And when you explain to the gogos, I always say that, many of our grandparents, they might not have the academic background, but the natural intelligence is there, a logical one where we're able to explain, to say medication, gogo, is not going to solve the problem. There are some things that you need to do. And sometimes you find that when you ask them what they eat, they will not tell you the truth, but you can see the sugar level. It's not necessarily under. So there's, so there's a lot of, how can I say, that is why we're saying that we're not seeing this. We're very we're obviously a technology-based company, but we believe the human factor, that whole connection between us and the patient, is so important. So we do include medication, we do. And then for those patients that are not diagnosed as yet, and probably they're not obviously registered with the government, so we do the whole, we'll do the screening on the basis of the indicators. Then obviously we'll say they have to go for the second line biomarkers, which we've done. We've partnered with Abbott International for their portable diagnostic devices. So we're able to do like your A1C at the clinic to check the, the renal functionality and all of those things. And once we can, the system confirms that.
Point of care diagnostics now.
Absolutely, absolutely.
Somebody is pricked now, within minutes, you have answers about, the kidney function, the liver function.
Absolutely, in 6 minutes. In 6 minutes, the patient is able to get that. And then what happens in that situation, what we do is that we understand that obviously there are some patients that are not obviously technology savvy. So they will not be able to email this, the medical records to, let's say, to the government. So what we do a printout, which is already on their app already, because all those records are on their app and they can PDF them if it's a patient that can actually work through the technology. But if it's not, we print it out, we give it to the gogo, and then we say we refer them to the nearest hospital so that they can be able to go and be registered on the database so that they can start receiving their medicines, their chronic medication. So, but between that period, we know that it takes about 7 days for them to get registered. So we do give them medication that helps them for 10 days so that they can get into the government chronic medication.
Beautiful. So, Doc, we've been talking about patient experience. What about your staff experience? I mean, there's a gogo there. Well, let me not say gogo, but there's a sister there who was just, I'm not sure if it's the video that I've just played or another video, but you could see how much she feels so good to have joined Alma, how the technology has transformed her outlook to patient care. She even says, I was born before technology. But actually, it's possible to actually embrace technology, even at my age, and deliver.
I mean, at over 55, it's amazing, right? So what we do is that our interviews, and I think it's the experience that I've had from the IKG side, is that in as much as people, first of all, they may be qualified, they may have the experience, but we focus a lot on their personality and character. And and because we want to make sure that our values are aligned with their values as well. So that's the first point in terms of how we recruit people, so that what they are going to do as well, it should not just be a job. It should be something that they love doing. It's a vocation. It's not just an employment. So that's those are some of so that's the first requirement in terms of taking people on board. And then the second one is that, and also we're looking for people that are open to learning, because if you look at the way we are doing things, it's something that a lot of people, even our employees, have never experienced themselves in terms of using technology at this level. So it becomes quite important that people are willing to evolve with the business. So the employee experience is maybe I might be biased, but we we believe that the structure in terms of we employing people on the basis of their character and personality has helped us a lot. You could see from the video that it's really, they feel empowered.
You know, it's almost like it's oil and water. If you compare Alma to all my other employers, you know, she actually sees the public sector. But anyway,
Okay,
right.
and that's the thing. If you didn't, and that's the challenge, is that if you didn't script the videos, because when I saw it, I was like, okay, I hope I'm not gonna get into trouble, because I didn't script it. It's people being interviewed and they're saying their own experiences, you know, and
So you are the CEO of the Alma Clinics and the co-founder of the Alma Clinics.
Yes.
I saw another co-founder. You know, I think it's Mr. Raf. So now tell me, what next for Alma Clinics? Obviously, you've set up this center or two in Soweto. What is your plan over the next 3 years?
So over the next 3 years, so first of all, the founders is myself, the co-founders myself, and Marcello. He's Italian but based in Switzerland. And then we have Dr. Snwamadi, who's based in Limpopo. Yes, in Polokwane. So basically, our plan is basically to roll out Alma Clinics in the next coming 3 to 5 years across South Africa. But also we have, because we've got Alma, we've got the digital health platform. The digital health platform, we've got a chief medical officer there as well at that level, who comes from a technology background. She's a medical doctor. She's Brazilian. So we are going to be testing Alma in Rio in the next coming 18 months as well, because she is based in Rio, in Brazil. So it's actually, initially when we started Alma, we thought, oh yeah, it's for Sub-Saharan Africa, and I'm very passionate about the continent, but also we are receiving quite interest outside of South Africa. And for us, you know, the Alma Declaration of 1978 was not talking about just South Africa. It was talking about how can we make sure that healthcare is accessible, it's affordable, it's equitable, you know, and really it's that's what is driving us.
Yes, yeah. So if there's an investor out there, are you going to be listing anytime soon, or are you going to be franchising the Alma Clinics? You know.
Yes. So we are going to be almost having a hybrid franchise of Alma, particularly for, you know, not exclusive, but particularly focused on nurses in our communities, because we believe that nurses, they carry the backbone of our healthcare sector. But often you find that they are demoralized, you know, they feel that, you know, all that they're doing, they're not being recognized. And also what we don't want, we want to make sure that we make it attractive enough to retain them, because also there's a trend where they're retiring very early. So we also want to keep them so that they can train the younger ones. So if you look at the way Alma is structured, we always have a senior nurse, 2 senior nurses, and we have a junior nurse. We're getting a clinical associate as well. And these are young people. Yes, they've got the academic background, but we believe nurses, they're also, you cannot buy experience. That's something that I always say, that experience, it cannot be bought. And we need to make sure that we close the generational gap as well in terms of skills, you know. So we will be franchising the Alma. And then secondly, yes, we are looking at obviously options to scale in terms of being able to go public at some point. That is very important for us, because it will help us to really make the Alma Declaration a reality, you know. Yeah.
And you also, you know, planning to expand into the continent.
Yes. We are already doing work, and we're following basically countries where Indigo Kulani Group is having projects, because already we have the networks in the same sector. So it's a lot easier to be able to actually establish Alma Clinic in those countries, because already we've done or are doing projects in those countries. So the next one will obviously be, we are looking at Nigeria, Lagos to be specifically, because we're doing some work there. We're doing some work in Abuja as well. and then and also looking at Tanzania, because we've done work in Arusha.
Yeah.
So yeah, so we will only for now focus on countries where it's a lot easier for us because we have the networks. Yeah.
Lovely, lovely, lovely. So let me ask you a question. Obviously, you became more like in healthcare. You started as a built, environment professional,
Yeah.
right? And then you specialized in the infrastructure of the healthcare space.
Yes.
Still a built environment professional.
Yes.
Now, anybody who's been listening to you during this interview, they will think, did she not go and do some, training in medicine and whatever? Because you've just internalized so much, you've learned so much to an extent that some of my colleagues cannot explain things the way you do. So how easy or how difficult has it been to actually get so engrossed into this part of, now this is not just about the built environment for healthcare, but it's actually about the soul of healthcare, clinical services, the delivery,
yes,
and
yes, yes.
act as an outsider. I'm using that, as an outsider.
Yes.
Person. And in our discussion, I did mention that, sometimes you need an outsider person to come into an industry to refresh it, which is what, the Virgin guy, what's his name now?
Richard Branson, yes, he's my...
Does. He comes in as an external person and comes and revolutionizes industries. And I see the same thing with you, coming from the built environment, you coming into the healthcare space, and you are intent on actually disrupting the space.
Yeah, I think one of the things that I'll say something that some of the people that know me, they say that I'm like a pit bull, right? Once I find a problem or an opportunity, I bite it. And what I mean by that is that for me, once I see a problem and opportunity, is that I become so passionate about it, and passion drives my curiosity. I mean, if you look at what the solution we're talking about here, somebody said to me, Sibongile, this is not just healthcare. I pity you because this is healthcare and technology.
Yeah.
And then there's the finance part, right? Because all of these, to be able to run such a model, it has to be so cost efficient. You need to make sure that it actually, for it to be able to create the value for all the stakeholders, for the shareholders, for the clients, for the and I think it comes from just my passion, and hence that's why once I'm passionate about something, I will make sure that, I mean, I've got a family, I've got a young family. I'm doing my master's this year in...
I was about to ask, because you're also doing an executive MBA in healthcare this time.
Yes, in healthcare this time. Because, and I think it's also my passion for healthcare. And like I said to you, that experience, you can't buy it. But then making sure that if you find something that you're passionate about, research and get to understand it so that your solution can, you can make sure that your solution, it's something that is not just a transactional one. And I found that sometimes you find that people go into businesses because there's a business opportunity. For me, it's the opposite. I go into it because how can I actually make sure that I get, how can I say, fulfilled from it? I'm able to change the dynamics in it, and somehow, but the entrepreneur in me does not forget about the business. But I know that when you do all of these things right, if you do all of these things right, anyway, this works, right? Because it will come anyway, but it can't be the other way around.
Yes, lovely, lovely, lovely. And so if people want to go and, test drive your Alma clinics, where can they go? At least, those who are based in Soweto, or who've got parents who are in Soweto, and they have been listening to you and they were like, no, okay, we know that my old folks normally go to Dr. So-and-so and Dr. So-and-so, but I would like them to go and test drive at Alma Clinic. Where is the Alma Clinic in Soweto?
Alma Clinic is at Protea North, at Protea Point. It's inside Protea Point at the shopping center. So we are right there, just two shops away from Pick and Pay. So yeah, so that's where we are. So we would love people to come and actually experience the Alma Clinic. And another thing that I just want to mention is that the Abio Care is not only exclusive to Alma.
Yeah.
So the doctors that would love to basically experience the Abio Care solution in their own facilities, they are most welcome to do that, because that's at a fee, of course. It's a business model, because we are saying, when it comes to innovation, right? And this is what I learned in the US, is that, true innovation is about sharing. It's not about keeping it to yourself. Yes, the IP is ours, but the solution, you share it, right? So, for example, and the benefits to the doctors of Abio Care is that right now, even doctors can actually have 1 or 2 nurses that could do this for them. And then, and that could also help them as well in their businesses, so that it's not all dependent on the doctor. And the doctor can start looking at obviously more severe cases, while the nurse can actually look at other primary healthcare and NCD screening. Yeah.
By the way, the future of healthcare in South Africa is going to be national health insurance. So are you, as the Alma Clinics, looking at when that comes in 2026, being part of accredited group of healthcare facilities to deliver 24/7, 365 to the communities where you will be present?
Absolutely, yes. And we like I said, being obviously involved in the infrastructure has helped us a lot to understand the NHI and the benefit that it will bring into the communities as well. Because we were also involved in not just, we're involved in terms of looking at design of the ideal clinics.
Yeah.
So when we were, so because of, yes.
That ideal clinic, and I went through the, that thick document. So, okay.
Yes. So on the infrastructure side, so we understand the whole model of the ideal clinic. We're involved in the design of some of the ideal clinics. And then, so we've looked at the Alma to say, how can we make sure even the services that are inside the ideal clinic, we have actually digitized them, they're inside Abio Care.
Yes.
So because we are saying that, we cannot continue to build this large infrastructure, because people are not looking for large infrastructure, they're looking for service. Yeah. And if they can find the service within a small infrastructure, is how, that is the most important thing that the communities are looking for. They don't care how big is the clinic. They want to know that, can I get the service that I need? Yes. So we've looked at that. So we've digitized the ideal clinic inside Abio Care.
No. I wanted to get there, because I thought that's what you guys have put up, but I wanted it to come through your mouth.
Yes.
Because it means you guys are futuristic.
Yes.
You are futuristic. You are looking at where the industry is going in the next 10, 15 years. And I mean, the WHO, in one of its meetings, the member countries, I think last year in September, if I'm not mistaken, they actually adopted primary healthcare as not just primary healthcare, universal healthcare, which is the NHI type of thing, with primary healthcare as the engine of that.
Absolutely. And if you look at, for example, what we are setting the model of what is the future of primary healthcare, or particularly primary healthcare. Because if you look at it, let's look at retail. How many shopping centers are being built right now?
Yeah.
Very few. Why? Because retail has gone digital. So the Amazon platform, that's a digital shopping center. Yes. And if you look at Abio Care, it's a digital clinic. Hence, that's why, and that is the future, is that we don't have this, we will not need the large infrastructure. And this is the architect talking, right?
Yes. Sibongile. Yes. I think we've run out of time.
Okay, all right.
Because of our earlier glitches.
Yes, okay.
we need to wrap up, but
Yeah.
your parting words to South Africans, about this new baby Alma Clinics.
Yeah, my parting words would be, I think it's more to just people in general in South Africa to say that, yes, we have many challenges, but Alma Clinic is basically a symbol that despite the challenges, we can continue to innovate, particularly in our communities, because particularly for people of my generation, we went to study and we went into corporate. It's great, but there are a lot of opportunities that lie in our communities, and this is what I've done.
Yeah.
And I think many of us can do the same.
Coming from Soweto and your first Alma Clinic in Soweto, how did that feel?
Oh, I just want to move back there. When you go there and you find that the spirit of the people is just happy, they're not stressed. When you're in Sandton, everybody's stressed and walking like they just want to, and then you go back to Soweto, but you go back with something like Alma. I think for me, it's one thing to just go there and visit my mom, but I always want to be, that's why maybe my name is Sibongile. I want to give, right? So yeah. I'm a give. So going back with something like Alma just really fulfills my heart. Yeah.
Yes.
Yeah.
All right. Anyway, Sibongile, thank you for your time.
Thank you, Dr. Fundi.
I'm very excited about your project. I think it's going to change. It's a game changer. It's a game changer, but it is what South Africa needs to go forward. And I like the fact that it is patient-centric, it's customer-centric. Sometimes we say patient-centric, and we just think that the experience must just be about the diagnosis. When you say customer-centric, exactly. I like it that way because they are customers to your business, and so it is a game changer. And I wish you all the best. And I will be coming one of these days to come and just see the center and maybe test drive some of the things. But I wish you and your partners all the best, and I'll be looking at the progress. And when there are opportunities, I need a clinic in Umtata, where I come.
Oh yes.
All right.
Yes.
So
thank you so much.
There, so we will need to talk about that. So I don't know what happened to your camera now. I can't see you anymore.
Okay.
All right.
Oh yeah.
Yeah. So I just want to say thank you very much and all the best.
Thank you, Dr. Fundi.
People actually embrace this new thing that you are doing. It's actually what South Africa requires. And may the funders, when it's time for you to grow, may they open their hands and be able to fund this project.
Yes.
We need many people like you to come and shake things up, because sometimes we get too complacent because we know this space and we don't see how we can actually improve some of these things. So thank you very much, and also thank you to all those viewers who were patient enough when we had glitches at the beginning.
Yes.
I hope we have made up for those initial glitches by actually having a very nice conversation. So I thank you all, and thank you, Sibongile.
Thank you very much, Doctor. Thank you to all the viewers. Bye-bye. Bye.